everyone. Um, I want to tell you about how a 46 years old man, African Nigerian, overcame depression in a very unique way. Now, if you have suffered from depression, you will know that it is something, it is a mood, it is a feeling that makes you feel that you are better off dead than being alive. Because the kind of depression I suffered, I am the 46 years old man, a Nigerian, was the type that affects your mood, affects your thinking, affects your reasoning. You're physically tired. You're not interested in anything, unmotivated. You prefer to be alone most of the time. Now, I was sort of introverted right from my days as a child. I grew to know myself as someone who talks very little, says little, you know, and I was kind of okay. But in my early childhood, I was quite playful. You know, what expect from a kid, jump up around the compound, play with neighborhood kids. I was pretty okay. But I discovered that right from when I got to the secondary school at the age of 12, it was sort of, I couldn't really place who I was. But I found solace in the fact that I could relate with other classmates who were Christians. I mean, we fellowship in the school fellowship chapel. I was a Christian by birth and I practiced Christianity. And I'm happy because it sustained me. I gave my life to Christ. I was able to flow. It didn't require that you become talkative or socialize. As someone who feared God, who was a Christian, you obey the Bible, you don't lie, you don't cheat, you don't go to disco parties, and you pretty much lived a good life. You told others how to live a good life, how to be right. But in when I was about finishing the secondary school, I noticed that I used to have this feeling of being shy, being timid, and I kind of just got by. Sometime in 1993, the mood became very, very severe, and I started asking myself questions. Why am I not able to socialize? Why do I feel like being alone? Why do I have repetitive thoughts? I was mostly unhappy. And somehow I got to the library. There was a library in the university when I got admission, and I began to read medical books. That was when I first saw the term, you know, depression, where one is so moody, you're unhappy, you don't enjoy things, your thoughts are clouded. This affected me. So I saw the symptoms of depression. I came to understand that it is not a new thing. I mean, there are many people who have suffered from depression. So, as I began to read some of these medical books, sorry, I cannot remember the names, but I came to understand that depression affects your thinking, affects your mind, you are moody, and all the symptoms were seen in me, and I started finding ways of how to overcome it. So I got to understand that there's some therapy, maybe psychological, you know, and eventually there's some drugs meant to alleviate the symptoms of depression. So some 2 years later, I was able to go to a hospital called Aminu Kano Teaching Hospital in Kano State, Nigeria. And when I told the psychologist or psychiatrist, I don't know exactly what term to call her then, and pretty much said I look normal. They invited me, they asked me to bring my mom. My mom was there. She said, well, he's a quiet chap. I don't think he's depressed, but if he says so, I just find him normal. He has been quiet, most secluded, quiet person, you know. But in order to talk much more, if you are really interested in watching me, these symptoms, sometimes I had chest tightness. I I wanted to be a different person. I was moody. I was unhappy. I was scared of life. And I began to understand that even depressed people start thinking about suicide. It was on the medical books I started to see that. And it became real to me that it looked like, if I could take my life, that would be the easiest way out. But being a Christian, I knew that suicide was sin, and I was really scared. How could I take my own life? I was really scared. I read from the books experience of people who committed suicide from depression. They wrote suicide, they dropped notes. There was this ambiguity in their mind. Should I do it? Should I not do it? The heaviness, the pain, I could not really succeed. I don't remember things. It was so much. Well, in order to just shorten the whole story, I got a book. It was also from one David, How to Overcome Depression. This was an Australian man who had gone through depression for some years, and he described the feeling. What I could remember, a depressed person doesn't like you to plan an event. Maybe he's expected to do something, an event, say maybe a birthday party or something, going out with people, stay in a social way, he's expected to say something. It's better things just happen, without being planned for. So he gave his story, how he fell into depression, how fortunately his wife was able to understand. And when he went to the hospital, he was given a drug, a medication, imipramine, which alleviated the symptoms, and a year or two later he was fine. So that made me to look for imipramine, and I started trying off-the-counter antidepressants, and it just made things worse. I discovered that I didn't feel any better, and after being, having so much hope, so much excitement that eventually I've gotten the cure for the depression, only to discover that it didn't work for me. And when I stopped taking the medication, I started having, scary dreams. And I got to understand that these are some of the symptoms if you stop taking antidepressive drugs. So, by the grace of God, I took several antidepressants. It still didn't work. But I just want to tell you, I want to thank God personally, because some 10 days ago, I, as a Christian, I had prayed, I had fasted, I had gone for deliverance from churches that I felt, I've seen in the television or on their videos where they prayed for people and casted out the spirit of depression. It never really worked for me. So some 10 days ago, I was in a hotel room, and I started thinking about the whole episode. And I came to realize, and I hope this helps someone, I came to realize that I could divide my experiences. Okay, I forgot to add something. I discovered that there were some times that the depression would lift. Sometimes if I was lucky for a week, sometimes for 3 days, it would just lift on its own. And I'll be very happy, I'll be excited, I will have a good sense of humor. Waking up wasn't a problem. I did not dread the day when I was depressed. If I wake up in the morning, I dread the day as if I should not get out of bed, you know. So I began to understand that it's like I have three different personalities. There was this personality that observed what happened to me. There was another personality who was timid, fearful, unhappy, scared, wondered what life was all about, you know, could not even do things on his own. Then there was the third personality. This was a person who is happy, who has a good sense of humor, who at least could get along with people. So it occurred to me that I have an observant self that knows what happens to me. And I have another personality who is timid, depressed, like a child, like a child who didn't develop to become an adult, who was always waiting for people to tell him what to do, who is afraid of taking decisions, who does not really define himself. And there was this other personality, the third one, who's an adult who knows what he wants to do. So somehow, I don't know how the thoughts came from several books I've read and things I've seen. I just told myself, it is this second personality that is depressed, that is unhappy, that is scared. It's like it's a little boy who has been with me, that is another part of me, who has not developed from being a boy who is scared, who is afraid of doing wrong things, who's waiting to be led, waiting to be corrected, you know. And my observant self, I now pictured myself in a room, and as if I was talking to this little boy, scared boy, I said to him, "Look, I know you have been with me for quite a long time. Now it is time for you to go. Thank you. We spent a lot of time together in my childhood. You are scared, but you are a child, and it's time for me to move on." And in my mind's eye, I opened the door. I told him, "Pack your toys, take everything you have." I was just quiet. I closed my eyes. It was as if it was in a meditative state, deep, quiet, meditative state. And I said bye bye to the boy. I opened the door. I just imagined he has taken his clothes, his toys, and I said, go outside and play. Yeah, there's nothing, and someone else has to come into the room now. And I imagined that the other personality, who I like, who I feel I want to be like, who is happy, who is self-contented, who is motivated, who knows what to do, who is not scared. I said, I opened the door and the little boy went out, and I said, "You, the older man, you can come in. Now it is time we stay together. It is time this is you. Let's go ahead." So after this deep thought, this deep imagination for like this happened with 30 minutes. And I told myself the other boy, the little boy was scared, has gone. He has gone to play. I've locked the door. Now the older man, the one who should represent my age, who knows what to do, has come in. And since then, when I opened my eyes, I woke up the next morning. I was happy. I was myself. Life made meaning. I knew then this is what I should have been. This is what I would have done. This is the kind of person I would have loved to be. And ladies and gentlemen, I have lost 26 years of my life. But I'm happy. I thank God that depression has gone. And I want to, for those of you who might have tried medication, who might have tried therapies of all kinds, and maybe your depression has not left, I want you to try this method. Close your eyes. Get into a place where nobody will disturb you. Think among yourself. Try to see if you can access your personality. See if you can describe, you can see yourself. Like I said, when the depression leaves, I'm a different person. When the depression is there, I'm a different person. But there's a part of me that observed what was happening to me. So you get into this state, you close your eyes, you you sort of forget about your environment and try to imagine deep if you have several personalities in you. And then you just gently tell the personality that you don't like. You imagine your opening door, say, "Okay, give him a name, whatever name you choose to call. You are my childhood, you are the depressed, unhappy state that wish to move on." Open the door and imagine that personality going out of your life. And then welcome the kind of personality that you want. Do this over, talk gently to the personality that you don't want to go. Tell him we have had a nice time together. Now you wish to we should pack his toys, pack his things, and leave. And have a nice day. You should go and play outside. There are other people that you can meet. Then you invite the other personality to come in. And maybe, just maybe, this could be a solution to your problem. And I thank God and I ask you to pray and take this step. If this can help someone, then I think my purpose for being depressed has been served. Take care. Bye bye.